Education Minister Angie Motshekga says it's all systems go for the return of learners to full-time classes tomorrow, despite the challenges such as overcrowding and stationery shortages. The minister says there are measures in place to ensure the safety of teachers and learners when it comes to COVID-19. For more on what we heard following that briefing this morning, we're joined by Professor Haroon Saloojee, and he is a professor of child health at Wits University. A very good afternoon to you, and thank you very much for joining us this afternoon. I think perhaps let's pick up on the issue of the food program and what this full return to schooling tomorrow means.
Thank you. The integrated school nutrition program is a vital mechanism to ensure nutrition for children. When it was at its best, it offered about 9 million children at about 18,000 schools. These would be the poorer quartile 1 and 3 schools, the opportunity to get one meal a day. And obviously with the lockdown, that was an important nutrition mechanism that was lost from children. So the fact that it's going to be re-established is excellent news. We know that initially it took a court challenge to get government to get the program going again, so it was going. But when it was assessed last year, some provinces like Gauteng and the Western Cape had about 90-95% compliance. But in other provinces like the Free State, it was down to 30% of children getting this program. So the fact that we're going to get all children benefiting again, or hopefully all children benefiting again, is a great step for children's health and well-being.
The minister also spoke about being able to do a number of social programs, including the deworming program, which will return, as well as sporting activities under strict COVID-19 observation.
Yeah, so again, the deworming program is an important component. In previous studies, particularly in the coastal areas like the Western Cape and KZN, in schools, primary schools, as many as 90 or 95% of children have had worms, particularly a worm called Ascaris. And so the deworming program is critical to ensuring that you kill the worms, which improves children's nutrition, but it also improves their performance at school. So the fact that deworming will return is welcome. And of course, school sports is a vital activity for children's well-being. Any activity, we know that during the COVID pandemic, activity levels in most children went down tremendously. And so the fact that schools will be able to re-establish their programs, particularly those in the open, is again a welcome development for children's well-being.
The minister speaking there, saying that she's confident that schools are ready for the new norm. What has been your assessment in terms of how schools have been coping with children while observing strict COVID protocols?
Yeah, so obviously we're dependent on the Education Department assessment on how well schools have been coping. But certainly from a health perspective, we haven't had, we've been in the rotation system now for more than a year, and we certainly haven't had major outbreaks of COVID at schools. There have been the occasional outbreaks. So the fact that we're moving from a rotation system to full participation now, we would hope would not meet with greatly increased numbers of children with COVID. Of course, there is that possibility in overcrowded schools, but I think we have to trust that the Education Department have done their homework and that we'll be able to cope with the increased number of children now, all children now attending schools all the time.
Minister Motshekga speaking about pre-COVID conditions, and one of those being an issue of overcrowding, where we had a problem with it before COVID, during COVID, and it's no doubt going to still be an issue. Your thought on that?
Yeah, so I think we've known for a long time that the Education Department has struggled with overcrowding. We've also had the problem of water and sanitations at many schools, particularly in Limpopo. There's been this ongoing battle that children don't have decent sanitation in particular. We've had the horrendous cases of school children drowning in pit latrines. So this has been a challenge for the Education Department, and undoubtedly the COVID hasn't made it any better. But one hopes that perhaps some of the additional funding that's now coming to the department will ensure that both the overcrowding, which the minister seemed to suggest has been addressed through the opening of more temporary structures, but also for me the issue of the toilets will now be addressed. But we all recognize that this has not gone away during COVID. I heard the Director General saying that they've actively tried to address the problem during the COVID closures. So I would hope that they'd be in a better situation than pre-COVID. This is going to be an ongoing issue, and I think we need to recognize it. And it does have consequences for children's health, because overcrowding will facilitate COVID transmission. We can't wish COVID away.
Just based on the work that you do, what kind of solutions could be offered to the Basic Education Department to help where this issue is concerned? She did speak extensively about infrastructure challenges, which is one of the pre-COVID conditions that she touched on.
Yeah, so obviously I'm not an educational expert, I'm a health expert, so I can't really make a strong case of what alternatives there are to deal with children who are in an overcrowded situation. What I can offer advice to both parents and teachers is about what to do of the current situation. And in fact, the measure we find now that we're really promoting is better ventilation, because that's as important as the other measures like wearing a face mask and washing your hands. And fortunately, because in South Africa we're in the middle of summer, it's quite easy to keep windows open in classrooms, to keep doors open in classrooms, and in fact even get children to do some of their education out in the open. I wouldn't be against that. It would be a very effective way of keeping COVID out. So sure, the structural challenges remain there, but at least we've got some mitigating measures to at least deal with overcrowding by simply improving ventilation. I think it would make a huge difference.
Professor Haroon Saloojee is a professor of child health at the University of Witwatersrand. Thank you very much for joining us this afternoon. We continue.